She seems like she's standing a little bit longer. Okay. Well, just let her do her thing. It's fine. I'll believe you. So
Well,
what do you
maybe
think's going on with her, Dr. Adams?
Well, it's obviously some neurologic thing. And the fact of the matter is we kind of are treating her for everything. So she just peed. She's that scared. But
Yeah, she's scared.
my guess is there's some kind of meningitis going on.
Meningitis?
Mm-hmm.
I had somebody comment.
That's way more.
Oh, yeah, that's a lot more. Buddy, sorry we got this big
Now,
guy, but
where did she come from again?
she was found stray on the street, just sitting on a sidewalk. And I had somebody say, I don't know what you think about this, but it just kind of one of those things where you're like, huh. I said, what if she was, like, whatever the situation would be, kept in a cage, a small cage, just all the time?
Yeah, but still, that would mean she'd have some muscle atrophy.
She has no muscle atrophy.
And her joints would be all sort of fused.
Okay.
Because I have seen that phenomenon before.
Okay.
And usually, what happens is, just because, usually because they're stooped down all the time, the legs lock in this sort of position.
Uh-huh.
So even when they try to walk, there's no, they know how to walk, they just can't stretch the legs out. But in her case, she clearly has good range of motion, the legs don't feel painful or tense or anything.
Yeah,
It's just when the harder she tries to do something, the less she can do it. It's like an attention twitch.
And it's this weird thing, the way she walks, it looks like it hurts.
Yeah.
It looks like she gets up and she starts to walk and it's like, ow, 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 and she stops. But you don't think it's actually painful. And she doesn't say anything.
I don't think it's, I don't think it's painful. I think she just can't, the brain is willing, but she can't do it.
Okay.
Now, again, this is way more activity than we got out of her yesterday.
Mm-hmm.
And so between the three things we're doing, something's working.
And what are the three things that we're doing?
So we gave her a mannitol infusion yesterday.
Mannitol.
Yeah, that's the sugar that we talked about that kind of draws fluid out of her brain if there's excess fluid. And then the other two things are a cortisone shot and an antibiotic.
Okay.
Now I would keep her on the antibiotic and the cortisone.
Okay, sure.
The only thing, there's no if. I'm just thinking about, cases that I referred to neurologists with this kind of issue. There's no end to the different things that they test for,
Right. Okay, yeah.
But I think there is one particular thing that might be worth checking. And it's actually, it's a parasite called Neospora.
A parasite called Neospora.
Neospora, they get from raccoon poop.
Raccoon poop, okay.
And so what happens is, since they're not primary hosts, raccoons just get diarrhea, just like dogs get from worms, right?
Okay.
So if she was a raccoon, she'd get a little diarrhea, but being a dog, the parasite goes into the brain and causes neurologic things.
Okay.
Now, it's treatable, but she'd need the right anti-parasitic medicine, which I wouldn't otherwise give her.
Okay.
I think though it's worth checking as long as we're.
How do we check for that?
It's a blood test. I can get it real quick.
Okay. Yeah. I mean, if you think, yeah, sure.
I think it's worth doing.
How much does it cost?
They talk about toxoplasma. I'll find out.
Well, I mean, is it like $20 or $200? It's going to be a bit.
Somewhere in between. Probably $150.
$150. Okay. So you hear that, everybody? So yeah, just want to let people know.
Yeah.
Because. All those, I know those fungal tests, everything, they're never cheap.
Yeah, she just doesn't have, we did x-rays, we repeated those x-rays, and there's no signs of pneumonia, there's no bone lesions, there's no compressed discs. So I don't think doing like the fungal test is all that worthwhile. But, since this is a marked improvement in just one day.
Mm-hmm.
So I would tend to just keep doing what we're doing.
Right. So what was the thing you said? The
mannitol.
Mannitol. I can never remember. It sounds like a TV show from the
Yeah.
early '80s. Mannitol.
Yeah. What was had wasn't T.J. Hooker? He was in a show, Matlock or something like that.
It sounds like something like that. Like yeah, exactly. You know,
Manitoul.
mannitol. Right. So I always think I'm saying it wrong.
Sounds like a robot.
All right. So mannitol, you just do that one. You wouldn't do that again.
No,
Okay.
no, I wouldn't.
Okay. So we'll continue with the cortisone and the antibiotic, which will be a pill or a liquid, I guess.
Yeah.
And then you'll do the blood test for the. Could you say it one more time? The raccoon.
Neospora.
Neospora.
Neospora. I'm actually going to see if there's a combo for Neospora and Toxoplasma.
Okay.
Toxoplasma is one of these things that gets talked about endlessly because that's what you have to test your cat for if you get pregnant.
Oh yeah. Okay. I've heard of that. Yeah.
I've never once seen a positive Toxoplasma test,
Okay.
but
Have you ever seen a positive raccoon?
Neospora, yeah.
Neospora.
Yeah, I have.
Okay. In California.
In California, in
Okay.
LA.
In LA.
Los Angeles.
In
yeah.
Santa Monica, right here in this office is
Yeah.
where it probably was. I mean, the positive test.
Yeah, I mean it's there's a surprising number of raccoons on the streets around here, and
Yeah. Oh yeah.
and if she's on the streets and may not,
Yeah, if
she
she
may
was
not
found
necessarily get it
out-
from the raccoon poop.
Yeah.
She can get it from drinking out of an infected water well or
Okay.
water source.
Yeah, she was found in sort of a suburban, out east, like towards Riverside, and yeah, there's definitely raccoons everywhere. In those,
Yeah.
yeah. Okay, all right, little girl, we're gonna let you go. See ya.